Well, hello and welcome to Ask the Doctor. My name is Jerry McGee and I'll be the host for today's show. We're here in Pittsburgh, Pennsylvania at Wellness Associates with Dr. Eugene Goldberg. Dr. Goldberg, thank you very much for your time. Doc, on today's show, we're going to cover a topic that I find very interesting and kind of, I think a lot of people will be able to relate to it. It might kind of be that aha moment for people where they want to look at things a little bit different. And it's this thing called Contact Reflex Analysis. Now, in doing some research, and I think all of our viewers can relate to this. We've all gone to a medical doctor for a physical. Okay, maybe we needed one for work, for sports, whatever. So we've all had physicals in the past. A chiropractic physical is a whole nother ball game compared to what they're used to. What can you tell us about that?
Well, we do different, Jerry. Of course, we look at your spine, your brain, your spinal cord. We look at your back because we're back doctors, okay? But what we do different is for the last 20 years, we've been doing CRA, which is Contact Reflex Analysis. Basically, it's based on applied kinesiology developed by George Goodhart in Detroit. We can actually scan your body, give you a physical through reflexes and muscle testing that relate to acupuncture points. So underneath your eyes are allergy points, metabolic, which checks all your organs, yeast, virus, heart, blood, adrenal, thyroid. We can check your brain. We can check your computer chip in the back. So by touching these key reflexes, we can get an answer through the reflexes and through the muscle testing, applied kinesiology. And once we find that, we find out what's involved, and then we can treat it with nutrition. So instead of taking a drug for the high blood pressure, there's actually a reflex on the arm for blood pressure. Find out what's causing it, scan the body, and actually treat it with nutrition. We've been doing this for 20 years now.
So these are things that you can find out a lot more than by just taking my height and weight, right?
You got that right.
My height, weight, and blood pressure, and that's my physical,
And your pulse.
Yeah, I mean, that's right. I think there's, one of the things that we've got to get people to understand is there's so much more to chiropractic care than the average viewer even understands.
That's right. They don't understand.
Right. I mean, it's... in my opinion is, and I know we've been doing these shows for a long time, and I've learned a ton on the different topics, but in my opinion, this is just a no-brainer for people to start to appreciate what chiropractic care can do, getting those evaluations, getting on a chiropractic maintenance program. You're not even going to have to go see other doctors if you're on a good chiropractic maintenance program.
I'm a chiropractic patient myself, Jerry. I don't go to medical doctors.
Your body's going to be functioning at a level where these other problems aren't going to come up.
See, the best case scenario is get your brain and your spinal cord functioning 100%, because your brain and your spinal cord is the master system which controls every cell and organ and muscle, circulatory system, heart, everything. And then once you do that, then you scan the patient from the front, which is the CRA, which is checking every cell and organ and muscle and body from the front, and see what is involved. And once you find out what's involved, you can treat it with nutrition. That nutrition is what heals you.
Yeah.
Okay, there's a theory that all diseases are from lack of nutrition. So if you give the patient the nutrition, they don't need the drugs, because in my opinion, Jerry, drugs don't heal anything anyhow. Okay, and then you have side effects from the drugs, and then you're on 5, 10, 15, 20, 25, 30. To me, health isn't taking 30 different drugs a day. It's impossible.
Well, and I also read an interesting conversation on this whole deal of these drug companies and everything, and that the drug companies, and this isn't a knock on drug companies, okay? They're in business to make money,
right?
Okay, so is it in their best interest to develop something that could necessarily treat a problem, or is it in their best interest to get you on something that you're going to take the rest of your life and just kind of treat some of the symptoms? From a business standpoint, they're going to create stuff that you need to take the rest of your life versus a short-term thing. And as we talk about in all of our shows, none of our problems are related to a lack of a drug.
This is true.
Right? None of them.
There's no antacid deficiency on the planet.
Right. I mean, but we always, it's in my opinion, and correct me if I'm wrong, but it's our decision to buy into that process.
It's your choice.
Okay? So, we've made the decision that we're going to go to our family medical doctor and we're going to treat everything with a drug. That's our decision. Now, you can change that decision at any given point. And today could be the day where you look at this and say, you know what? These 7 drugs that I'm taking are not only, hard on me financially, but they're not doing what's in the best interest of my body.
Side effects.
Today's the day to make a change. And we encourage you to pick up the phone and come down. Talk to Dr. Goldberg and ask the questions. I think that's where people, they're not asking enough questions about, to their present health, care, practitioners, whoever they are.
I have a question for you, Jerry. Just pretend like you're the average patient.
Mm-hmm.
Do you think health is a chance, or do you think health is a choice? What do you think?
Oh, it's definitely, I mean, I've learned enough that it's a choice.
But people think health is a chance.
Yeah.
They don't think there's like a direct cause and effect relationship. See, my opinion is we live in a cause and effect relationship. So if you have an effect illness, there has to be a cause. It's something that's been caused into your life, or that you chose that, either your diet, your lifestyle, your nutrition, and your structure. So therefore, if you do those 4 things, health isn't a chance, it's a choice.
Yeah. I know one of the things that we had mentioned in some of our discussions in the past talks, we talked about this genetic connection.
Right.
Okay, and you have an interesting take on this whole thing of genetics.
See, genetics are very, very important. Okay, now see, genetics to me is a loaded gun. Now you have this loaded gun, but your lifestyle pulls the trigger. So just because your mother and your father had something doesn't mean you have to have something, because you have the same lifestyle. Yeah, you're going to probably, if you're in the same diet, you're eating the same food, the same nutrition, your spine's the same, yeah, you're going to probably get the same diseases, because the genetics is a loaded gun, the lifestyle pulls the trigger. I'm not going to pull the trigger, Jerry.
That is an interesting concept.
But it's true.
Right. But I don't know if I've ever heard it explained that way, because so many people, when they look at the genetic factors, they just assume, okay, I'm going there.
Not necessarily.
And really, it gets down to almost this definition of insanity, where you're doing the same thing, but you expect different results.
That's my definition.
Right. And that's where I think people get mixed up in that. These things don't have to just be, oh, that's the way it's going to be. Your choices can make a difference and impact those things. And it's never too late to make those decisions.
See, to me, genetics can be like a scary thing, where the medical doctor says you have this, it's genetic, there's nothing you can do with it. My answer is, there's something you can do with it. You can make some changes in your life. Positive rehabilitative changes in your spine, in your nutrition, in your diet. Get off coffee. Why? You get off coffee, your blood pressure comes down. Get off the Red Bull, your blood pressure comes down. A lot of times the medical doctor's not telling them this. He's putting you on the drug, he's treating the effect. The cause is something that you're putting into your body that you chose. So change what you're putting into your body, and that can change your life.
Yeah. I really think it's just time for all of us to wake up, get out of, we've been in this system for so long where it's just like, oh, that's the way it is. We don't ask the questions. We don't kind of, say, well, can I get a second opinion?
Right.
We're letting one individual kind of guide our entire life.
Right.
And we've just got to wake up and start saying, hey, listen, it's my choices. My health is my decisions. I'm going to make those choices and start really getting educated. That's what I love about these shows that we do, and I really appreciate you spending all this time with us, because I think these shows are just an invaluable resource for people to start to understand how all this impacts. And I hope people are watching enough of these shows that they start to put it all together.
Tie it all together.
Because it really does. It's a big, our health is just a big puzzle where we got to put all these, pieces in place. And if you're missing some, you got to get them corrected and get them back in place.
The word I like, Jerry, is responsibility. Now, I don't know if you know what that means, but my definition of responsibility is your ability to respond. That if somebody gives you lemons, you make lemonade. If somebody gives you a diagnosis, the question is, what are you going to do about it? What's causing it? And we're kind of like doctors of cause, okay? So we're going to find out the cause of why you have the diagnosis, why you have the syndrome, and we want to fix it, we want to correct it. It's simple.
Yeah. I mean, really, it is, it is a simple concept. I mean, we can't stress that enough. And, I just hope that after watching this video, you'll understand, you know what? Maybe I need to go down to Wellness Associates and get a true physical.
Right.
Something that's going to look at all these issues and not just be the classic, how are you feeling? Oh, not bad. Okay, you're good. We've got to start looking a little deeper. Every year that goes by, things are coming up. Now is the time to start. It's never too late to start, but it's always better to start earlier. So, today could be that aha moment for you where you say, you know what, I'm going to give Dr. Goldberg and Wellness Associates a shot. I'm going to go down there, take advantage of the new patient-free evaluation that he offers, kind of see what this place is all about, ask these questions, start to take an active role in your health. I think you'll be amazed at the results that you will have. You're going to feel better. You're going to have energy. People are going to be asking you, what are you doing? Because you're just a different person. So we hope you take advantage of that and visit Dr. Goldberg at AskDrGoldberg.com. Give him a phone call, stop down, meet the girls, meet the staff, and see what this place is all about. It'll definitely change your life. So with that, thank you very much for spending some time with us today. We hope you found this to be educational and informative for you, and just be sure to check back often. I mean, we constantly bring new topics and new situations to the table that we're going to discuss, things that could be impacting you or a family member. and just things that can really have an impact on your health. So thank you very much for spending that time with us, and we look forward to seeing you on our next episode of Ask the Doctor.